Welcome to the Ultimate Chlamydia Masterclass. We're going deep into one of the world's sneakiest STIs, Chlamydia trachomatis. Think of it as a ninja, quiet, hard to detect, and if left unchecked, capable of some serious damage. But don't worry, you're about to become a black belt in busting it. Meet the microbe. So, who is C. trachomatis really? It's not your typical bacteria. It's tiny, gram-negative like, but it doesn't play by gram-stain rules. Why? Because it doesn't have peptidoglycan in its cell wall. So if you try to find it with a regular microscope, you'll be ghosted. It lives inside your cells like an uninvited Airbnb guest who never pays rent. Here's the two-step hustle. Step 1, it shows up as an elementary body, a tough little spore-like form that's all about transmission. Step 2, once inside your body, it transforms into a reticulate body, a soft, multiplying form that turns your cell into its baby factory. Then, boom, it flips back into its infectious form and bursts out to find more cells to hijack. The whole cycle takes just 2 to 3 days. Fast, silent, and ruthless. How it spreads, silent but efficient. Let's talk transmission. Chlamydia is not shy when it comes to getting around. It spreads through vaginal, anal, or oral sex, from mom to baby during childbirth, even from hand to eye. Yep, that's a thing. Think one-time contact means you're safe? Not quite. Each unprotected sex act carries a risk, around 10%. Over time with an untreated partner, that risk jumps to more than half. Serovars and syndromes. Chlamydia comes in different flavors, called serovars, and they each have their drama. Serovars A to C. These guys hang out in places with poor sanitation and cause trachoma, a preventable form of blindness. Serovars D to K, the ones responsible for most urogenital, rectal, throat, and eye infections. Serovars L1 to L3. These are the heavy hitters. They cause LGV, lymphogranuloma venereum, an invasive STI often seen in MSM communities. Clinical drama, symptoms or lack thereof. Let's be clear, chlamydia is often symptom-free. That's its superpower and our biggest challenge. In women, most women don't know they have it. But when symptoms do show, they may include abnormal discharge, bleeding between periods, pain during sex, burning when peeing. Left untreated, it can crawl up into the uterus and fallopian tubes, causing PID, which can lead to infertility, ectopic pregnancy, chronic pelvic pain. And here's a twist. It can even climb to the liver capsule and cause pain up under your ribs. That's called Fitzhugh-Curtis syndrome. In men, symptoms are a bit more noticeable: clear or cloudy discharge, burning when urinating, itching at the tip. It can also cause epididymitis, a painful swollen testicle situation that nobody wants. And in some cases, men develop reactive arthritis, joint pain, eye irritation, and urethritis. The old can't see, can't pee, can't climb a tree trio. In all genders, rectal infections, pain, discharge, bleeding, or nothing at all. Throat infections, usually silent. Eye infections, thanks to finger-to-eye spread, itchy, red, gooey messes. In babies, if mom is untreated, baby can be exposed during birth, and the consequences are serious. Inclusion conjunctivitis shows up 5 to 14 days after birth, puffy red eyes with thick discharge. Pneumonia arrives a few weeks later, dry cough, fast breathing, but no fever. Important note, the standard eye drops babies get at birth won't prevent this. Only treating mom during pregnancy can. If a child beyond the newborn stage has genital or rectal chlamydia, that's a red flag for possible sexual abuse. In these cases, clinicians must use the most specific tests, document everything, and get child protection involved. Diagnosis: how we catch the ninja. We've got high-tech tools now. The best is the NATEAT, Nucleic Acid Amplification Test. It looks for the DNA or RNA of the bacterium itself. It's fast, accurate, approved for use on multiple sites. You can test first catch urine, vaginal swabs, self or provider collected, endocervical, rectal, throat, or urethral swabs. Tests like EIA, serology, and DFA? Old news. Leave them for special cases like child abuse or neonatal conjunctivitis. Who to screen? You screen the people most at risk. And here's how. All sexually active women under 25 screen yearly. Women over 25 screen if they've got risk factors, new partners, no condom, STI history. Pregnant women screen early in pregnancy and again if they're at risk. Men who have sex with men MSM screen at least once a year, more if they're high risk. People living with HIV screen at all exposed sites yearly. Heterosexual men, only if they're in high prevalence settings or showing symptoms. Treatment, cure is simple. First-line treatment for most people, doxycycline 100 milligrams twice a day for 7 days. It's effective even for rectal infections. Alternatives, azithromycin 1 gram single dose, good for people who won't finish a 7-day course. Levofloxacin if there's doxy allergy. Pregnant women, use azithromycin 1 gram single dose, safe and effective. Infants with conjunctivitis or pneumonia, treat with erythromycin 50 milligram kilos your day in 4 doses for 14 days. For LGV, you need a longer course. Doxycycline for 21 partner management. Treat all partners from the past 60 days, even if they don't have symptoms. No recent partner? Treat the last one. And this is big. No sex for 7 days after treatment starts, and not until all partners are treated too. Some regions allow expedited partner therapy, EPT, giving meds or prescriptions to partners without a visit. It works when it's legal. Public health and notifying partners. Chlamydia is usually written up on a partner notification slip and given to all sexual partners. Why? Because tracking it helps control the spread and protect communities. If children are involved or abuse is suspected, follow your country's child protection laws and report immediately. Quick recap. Chlamydia is common, silent, and sneaky. It's easy to test for and treat. Most people don't know they're infected. Untreated, it can lead to infertility, chronic pain, and more. Screening and partner care are essential. NET is the gold standard. Doxycycline is your go-to for treatment. That's it! You've made it through the full, fun, and fearless guide to Chlamydia trachomatis. You're now ready to screen, treat, educate, and advocate. Because when it comes to STIs, silence isn't golden, it's dangerous. Yeah.